Fear of anesthesia is extremely common. In fact, according to a recent study, 88% of patients experience anxiety at the thought of anesthesia. Patients at the Appearance Center of Newport Beach, however, now have the option for an alternative to general anesthesia. It's called gentle sleep, and its main component is a revolutionary drug known as Precedex.
For me as a facial plastic surgeon, Precedex has been a game changer in many ways.
Anesthesia is a blanket term to describe the tools and techniques anesthesiologists use to block the feelings of pain for a patient or put someone to sleep.
When I'm doing long surgeries where detail is critical, sometimes we get pressure to finish quicker, especially when patients are under general anesthesia, where they have some medical issues, and we really want to minimize the risks of the anesthetic. So we have to balance the risk of prolonged anesthetic with surgical outcome.
On this graph, local anesthesia, or injection anesthesia, sits near the bottom, ideal for short, simple procedures in which the patient remains awake. Further up the graph sits sedation anesthesia, where patients are asleep. Sedation works best for mildly complex cases under 3 hours, where local anesthesia is not possible or not preferred. Further up still is general anesthesia. General anesthesia is safe for the vast majority of the population, and can be used on anyone under certain important medical circumstances. When it comes to cosmetic surgery, however, older patients or those with certain health conditions may find themselves at a barrier. The risk for these patients is simply too high to justify a cosmetic procedure, and previously, it was not possible for these patients to undergo general anesthesia for cosmetic procedures. With gentle sleep, this barrier disappears.
With Precedex anesthesia, it allows the surgeon to perform much greater detailed surgery without being rushed.
It's really become the perfect combination. We use a little bit of Precedex, a little bit of propofol to achieve that perfect level of sedation. Otherwise, previously you would run into patients having obstruction during the middle of the procedure, or they'd wake up and they'd start to move a little bit. With the Precedex on board, they're nicely sedated. Even if they wake up, they just kind of flutter their eyes and then head off back to sleep again.
Precedex has been in use for over 20 years in hospital settings. We have adapted Precedex anesthesia nowadays for outpatient plastic surgery in our surgery center. I'm proud to say that the Appearance Center is one of the first outpatient surgery centers to introduce this application in Orange County.